Welcome to the Senior Rehab Podcast,
the podcast for rehab clinicians that want to better serve older adults.
And now, your host, Dustin Jones.
Hello, friends. Thank you for the download. This week's Senior Rehab Short comes from our good friend, Steven Stockhausen, who was a previous Senior Rehab podcast guest with his lovely wife, Ellen Stockhausen. This article is titled, Calling for the Death of Seated Exercise, written April 18th, 2016 on ptadventures.com. This article is about the death of seated exercises just as much as is the fact that home health patients are seated exercising to death. I must apologize in advance, but this is a topic I'm quite adamant about and will hopefully offend a few of you into feeling repentant about your seated exercising ways. At this stage in the ever so slowly evolving profession of physical therapy, we have firmly established ourselves in the epoch of functional training. Before functional training, there were gizmos and gadgets. Before that, progressive resisted exercise of isolated muscle groups. And before that, I don't know, maybe iron lungs and things of that sort. But needless to say, the research supports, my favorite phrase as a new grad, training functional activities both with and without loading to improve mobility and balance. In a profession that prides itself on the fervent pursuits of efficient and effective patient care, it seems there are a few of us who have missed the boat. Now, I am not writing off all exercises performed in a seated position. I've seen Dr. Matt Lee work magic on a client's painful arthritic knees with the use of a simple heel slide exercise and the proper cueing. But this article is an intentional affront to the use of the obnoxiously amorphous and ambiguous term that keeps rearing its ugly head in treatment notes across the country: seated exercise. Often this is followed by the equally nondescript and infuriating supine exercises, but please don't get me started. Just like treating patellar alignment for patellofemoral pain or stretching the hamstring of a patient with sciatica, neglecting functional training and opting for a generic seated exercise set is an insult to the profession of our field. When our home health patients are receiving help, it is due to homebound status. Think about that term for a second. They are so weak, sick, injured, demented, etc., that they are literally bound to the home. It is so difficult for them to leave the home that it has been deemed medically necessary for them to remain there. What good is 10 reps of Musgrave ankle pumps? And Musgrave is a reference to one of our PT school classmates that was just obsessed with ankle pumps, almost as much as Cindy Kraft is. But let's keep going. For restoring their freedom. Oh, you're doing it to reduce the risk of DVT, you say? Why not put them into one of many different positions that will progress them towards the ultimate goal of liberation from their own home? Walking, lunging, marching, rising on their tippy toes, even weight shifting, for goodness sake, can have the same muscle pump effect you are so dutifully pursuing, but also places a more practical focus on the greater goal. At this point, I have to bring up the sobering reality that many of us are not challenging our patients enough. Yes, they are old and sick and weak and often somewhat confused, but that doesn't mean we should coddle them all the way to the grave. If we are not placing our patients into positions that are difficult or unsteady when we, the trained professional, is present, then there is definitely no chance that they are going to attempt to do so when they are alone. It is time we ask more of our patients and possibly ourselves. Many of the home health clientele has limited exercise capacity to begin with. So get creative and challenge multiple systems at once. Transitional movements, gait progressions, or even some bed mobility tasks will have better day-to-day carryover than sitting and flopping around the distal end of some appendage. When we go to the hardware store to get a drill, we did not really want a drill. We want a hole. In the same way, our patients may be prescribed PT for whatever diagnosis, but what they really want is their life back. Life is short for us all, but for others it is even shorter. We owe it to our patients and we owe it to ourselves to keep this in mind. A PT visit is just another visit to us, but to a frightened aging client, it is a second chance at freedom. Thanks, Doc. Hit me. I want to thank you for listening to this podcast. The show notes and much, much more can be found at seniorrehabproject.com. I want to encourage you to go there so you can join me and many others in the movement that's changing the face of geriatric rehab. Just go to seniorrehabproject.com, click join, and you'll be able to get access to our private Facebook group, which can basically serve as your virtual mastermind group. You'll get a short and sweet monthly email from me with useful links for you and your patients. And lastly, you'll get 10% off your first purchase from the Senior Rehab store. So all of this can be found at seniorrehabproject.com. And until next time, my friends, do not forget to stay funky.